name's Katie Nicholas. I'm a knowledge specialist and I work in the Health Education England's knowledge management team, which is a national team. So a little bit more information about our team. So it's led by our programme manager, which is Emily Hopkins. And then we have 4 knowledge specialists working in different regions across the organisation, because the organisation covers the whole of England. So there's myself, Katie Nicholas. I'm based in the north. Usually I'd be in the Manchester office. My colleague Liz is based in the south. Joe McCrossan is based in Midlands and East of England. Matt is based in our London office, and Kate's our team administrator, and she'd normally be based in Leeds. So what is a lunch and learn session? How does it work in our organisation? So lunch and learn sessions are informal sessions. They're normally less than an hour. And we invite a speaker from usually somewhere within Health Education England itself, or sometimes it's a guest speaker, and they'll come along and they'll deliver a discussion or a short talk on a topic. So usually it's an area of work or a new programme or project. And then staff are invited to join the session. They can ask questions, discuss the topic that's being presented on. And they're all about learning and conversation. So before COVID, this would have been in a room in the office. We'd have had an option to view online through Skype for anyone who wasn't in the office that day or worked in a different office. So we had that blended approach. It was both an in-person and a virtual option. So obviously with COVID, as with so many things, we've had to change the way in which we work a little bit. So what we did, the speakers or speaker still present on a topic, and it was still usually someone from HEE. All staff are still invited, and all staff can ask questions and post comments, but the sessions are now entirely virtual. So since March, HEE staff have been working at home because of the pandemic. So the sessions have moved entirely online, and we're now using MS Teams. So where we had that hybrid before, we've gone to entirely virtual sessions. But the remit and the kind of the main objectives of the sessions haven't changed. So what's the knowledge management team's role in the programme? So really we take suggestions, we look for ideas of hot topics across the organisation. We look out for people starting new projects, or maybe we see something that we think the rest of the organisation should know a bit more about that's really interesting, and we want to share that. We look after organising a day at a time, setting up the meeting, doing some of the promotion for the sessions. So we work with our comms team to kind of get the message out there when there's a new session. We'll try and plan the programme in advance and match it up with any campaigns or areas of work as we're going along. We take a kind of facilitator role as well, so I'll manage the recording of the session, do a bit of virtual etiquette, explaining how it works. I think people are a lot more familiar with that now, but it's still good practice to kind of just recommend everyone's on mute, using the hand up feature on Teams and using the chat box. So obviously we record the sessions, as I said. So another element of what we do is to share the recording afterwards. We gather all the materials that people have used, so that might be the slides or any links or references that people have talked about. We'll gather all those together. The recording is shared on an internal video channel that the team has, so anyone in the organisation can view those. And we have a SharePoint site for all the materials from every session that we've run. And I should say we don't have ownership of this programme across the organisation, so it's happened quite organically across the country. Teams will kind of set their own session up, they'll find their own speaker, they'll deliver one on their own team, for example. So if we see any of those going on across the organisation, we try and promote those sessions and make the rest of the organisation aware of those sessions. So we also take that role. So we aren't kind of tied to being the only people that set them up. We're happy for anyone and everywhere that's running them, and we're happy to share and encourage people to participate. So I thought it might be useful to give you a sense of some of the topics that we've covered since lockdown. Before COVID, the programme was very much centred around kind of key programmes, areas of work, or big kind of system hot topics, things like apprenticeships or genomics. But because of lockdown, we've slightly changed our approach a little bit. So in April, we had our first session that was planned pre-COVID. It was supposed to have happened in the office, which was about a new, like a pilot in the Northwest for this assistant practitioner mental health role. So that was one of the more traditional topics, but we changed the setup of it, so it ran virtually. And then you can see between May, June and July and August, we teamed up with our Health and Wellbeing Directorate for the Northwest. There's a small group of staff that run that programme, and they were keen to have a programme of things on offer for staff because they knew it was going to be difficult with lockdown. So we worked with them to plan a programme of lunch and learns. So we had, and mostly these were guest speakers actually, but a couple of them were our own staff. So we had one on emotional health and wellbeing, physical health and wellbeing, behavioural health and wellbeing, and spiritual health and wellbeing. And then to coincide with Health Literacy Month in October, we had a session from our LKS colleagues on health literacy. So as I mentioned, some of the other topics that we've covered in the past, just to give you a flavour of the kind of things the range of things that we've discussed. So we had one on the 100,000 Genomes project, which was linked to HEE's genomics education programme. We had one on apprenticeship reform when the levy was first introduced. We did some sessions on that. We've done sessions on veterans and health because that was linked in with some work that one of our staff members was heavily involved in. And then we had sessions on wellbeing and Schwartz rounds, and that's just some of the sessions that we've had over the years. Going back to the ones we ran over the summer, so this is one that I thought you might be interested in, just to give you a sense of the kind of things that we discussed. So it was a guest speaker. It was a lady called Reverend Dr. Susan Salt, and she led our spiritual health and wellbeing session, and she had a really interesting perspective because she was a trained clinician. She'd worked in the NHS for a number of years. She left the NHS to go and pursue religious. She went to be a reverend. And then because of the pandemic, she was called upon and she came back and she helped out. So she's definitely kind of got that interesting perspective of seeing both sides of that. And her talk was very interesting. It wasn't about religion at all. It was much more about how people can connect with their own spirituality, especially in a situation like the one that we're all in at the minute. And I thought I'd include a little screenshot just to show you the way in which we share the recordings of the session. So this is our stream channel, which is part of the Office 365 platform, and it's for the team, this one. But what we do, we post the recordings of the videos are posted on the channel straight after the session. We make them available to all staff in the organisation, and you can see that people view them afterwards, and the whole point is that if you miss it, you don't miss out. You can still watch it and get the information, and it's also contributing to that corporate memory of the organisation. So it's capturing what went on at a period in time. So we've got that for the future. So what we've noticed since we've all been working from home and we changed the way in which we do them is that we've had a massive increase in attendance. So we might have had maybe 20 or 30 people in a room in the office, but we've had upwards of 400 attendees across the different sessions. So we're averaging 50 or 60 or 70 a session. And that's not including the people that view the recordings afterwards either. It's meant that we can open up the sessions, so staff in every region, wherever they're working from home, they've got the laptop they can join. And that was much more difficult before because obviously not everybody's in the same office. People had other meetings they were attending. It wasn't as easy to dip in and out as it is with a virtual session. And we've seen some guest attendees as well. So the remit of them is mainly for internal purposes, but for some of the topics, there's no reason why external people from across the system can't join in because they're of interest to staff, and we're happy enough with that if the speaker's happy with it. So some of the things to think about really, what next? Well, I think it's been fruitful working with a specific HEE group like the Health and Wellbeing group to identify and plan topics. So we've got a much more kind of organised programme of stuff. And we're now working with the National Health and Wellbeing group as well to make sure all those different groups have oversight on the different activities that are going on, and we're much better at sharing them now. So I think that's been really fruitful. We're working on sharing other sessions being set up across the organisation, so trying to link in with much more groups of people and find out when they're running them. Can we share it? Can we add it on our events list so people find out about them basically? How can we align these sessions with some national campaigns and get that programme developed, so it really links in with what else is being discussed? And then something I'm quite keen on is thinking about how we engage with participants a bit more. So obviously in the traditional sense, the session would have been really informal. People would have brought lunch along, they'd have had a chat whilst they were waiting for the speaker to start. We'd have had a lot more informal, organic opportunity for questions and discussions. So I'm interested in how we might rekindle or create some of that in a virtual environment with much larger numbers of attendees, which can be sometimes a little bit more difficult than if you were all in a room. So I think, as with all of these things, there's pros and cons to the different approaches. So we're just going to keep working on different ways we can do that, really. So I'll leave my contact details on the screen there. I've also put the team contact details in there, so if you've got any questions or if you're interested in finding out a bit more about how we run them, do get in touch, and we'll be happy to answer any questions. Thank you very much.